Good morning and good afternoon, everyone. Welcome back to the DASH webinar series. My name is Carissa Novak, and I'm a program manager at the Harvard Global Health Institute. I'm excited to welcome you here today for our third webinar in the DASH webinar series, AI, Health in the Future Workforce. This webinar is part of a new 4-part virtual event series co-hosted by the Novartis Foundation on the intersection of AI, COVID-19, and low resource settings. It builds off a previous 8-part series we hosted in the spring and summer as part of the Data Science and AI Summits for Healthcare. On Thursday, December 17th, we will have our 4th and final event, Catalyzing Connections in Data Science and AI for Health, a virtual networking event featuring a keynote speaker and flash talks from digital health innovators. For more information on this event and others, including recordings of past webinars, please visit us at dashinafrica.org. In today's webinar, we bring together panelists with a diverse range of expertise in data science and AI to explore the role of education and professional development as a means to unlock the full potential of AI for health tools. Before we get started, I have just a few housekeeping notes. This video is being streamed through Zoom, Facebook Live, and the recording will be made available on the DASH website afterwards. We will be running a live Q&A towards the end of the webinar, so we've enabled our Ask a Question feature on the bottom of your screen. If you have any questions during the webinar, just pop it there and we'll do our best to answer them during the Q&A portion. We've also enabled the chat function, which will be monitored and overseen by my colleague Luke. When using this function, please make sure you set the message recipient as all panelists and attendees and not just the panelists. To get us started, we'd like to invite all of our participants to use the chat functionality to let us know where you're connecting from today, including the city and country. I am calling from Boston, Massachusetts. With that, let me introduce you to our speakers today. Bethany Het-Gauthier is a biostatistician and associate professor of global health and social medicine at the Harvard Medical School and biostatistics at the Harvard T.H. Chan School of Public Health. Her primary research interests include quantifying the health needs of and evaluating programs targeting marginalized populations, with a focus on global surgery research. She currently leads research related to the provision of cesarean sections and outcomes at rural district hospitals in Rwanda. This body of work includes developing machine learning algorithms for image-based diagnostics for surgical site infections. In addition to her research work, Bethany leads scholarship and advocacy on equity in global health research collaborations. Her work spans multiple countries with extended residencies in Namibia, Malawi, and Rwanda. Angelou Marie Estrella is a senior manager at Reach 52, a Singapore-headquartered social enterprise looking to create healthcare systems for rural areas across the Philippines, Cambodia, and India. She implements community-based projects in the Philippines that are bridging the gaps within healthcare systems through digital community-run solutions. She leads both physical and virtual training for community healthcare workers and youth leaders in rural areas, as well as manages a team rolling out a range of health services. Mahadia Tunga is the co-founder and director of capacity development at the Tanzania Data Lab. Mahadia is a trained computer scientist with a specialization in data science. She has a keen interest in strengthening the data ecosystem in Tanzania and Africa through capacity development. She has vast experience in managing capacity development projects, as well as gender-based and youth engagement programs with special interest in assisting young women. Mahadia has delivered strategic consulting for both public and private health programs focused on machine learning, open data, data innovation, visualization, and analyses. As an academic at the University of Dar es Salaam, Mahadia has contributed to the development of the first ever Master of Science in Data Science curriculum in East Africa. And lastly, our moderator, Natasha Sunderji, is a global health lead for Accenture Development Partnerships, an innovative business unit at Accenture that works with leading international development organizations to address the world's social, economic, and environmental issues. Natasha has 15 plus years of experience advising multinational companies, social enterprises, NGOs, and multilateral agencies on growth strategy, business model design, digital health, and cross-sector partnerships. She has worked with leading organizations to design patient-centric technology solutions, supported impact investors to develop commercialization and scaling strategies for their portfolio grantees, and advised policymakers on the regulations and investments needed to drive a robust digital health ecosystem. And with that, I'll hand the mic over to Natasha, who will be leading the discussion.
Perfect. Thank you so much, Carissa. Good morning, good afternoon, good evening to everyone on today's call. I'm thrilled to have you joining us today for what I'm sure is going to be an incredibly engaging discussion. As Carissa highlighted, today's discussion is really focused on AI, digital education, and training. And as you've all seen through the DASH webinar series, we've really noted this point that AI is today's defining technology. It is one of our greatest opportunities to transform healthcare systems. And it was really the COVID-19 pandemic that solidified its importance and the vast applications that exist around data science and AI in the healthcare sector. From the work of Blue Dot to Tencent to Vuno to Behold AI, there are new innovations that are popping up each and every day. Yet, as countries think about AI and how to integrate these technologies into their national strategies, it is imperative that they're simultaneously investing in the local people and in the workforce that will create these technologies and also use them. In a recent report that was co-developed with the Novartis Foundation, Reimagining Global Health Through AI, we outlined that people and workforce was one of the 6 areas that countries needed to prioritize in order to advance their journey to AI maturity. This idea of a country workforce and education system, they're truly the foundations of AI in health. From building a national curricula to building capacity within educational institutions, professional training, on-the-job training, national talent acquisition and retention strategies. All of these are really critical to the creation and appropriate distribution of that highly skilled workforce that's capable of not only ensuring AI-powered solutions in health are developed, but that they're also developed appropriately and reach those most in need. So in today's discussion, AI, health, and the future workforce, we're going to explore the role of education and professional development and training as a means to unlock the full potential of AI for health tools and reflect on how countries can best prepare to create, recruit, and even retain that experience in the field. I'm joined by a brilliant panelist of women with fantastic experiences to share. First and foremost, Bethany Gauthier, the Associate Professor of Global Health and Social Medicine at Harvard Medical School, and she's been driving really exciting partnerships between data scientists in Cambridge and Kigali. Angelou Marie Estrella, Senior Manager at Reach 52, which is a social enterprise that aims to strengthen health systems for rural areas in the Philippines, Cambodia, and India. And last but not least, Mahadia Tunga, the co-founder and director of capacity development at Tanzania's D-Lab, an NGO driving innovation and data literacy to promote data-driven decision-making in Tanzania. Bethany, Angelou, Mahadia, thank you so much for joining us here today. Before we dive into the discussion, I do want to do a quick round robin amongst the panelists so we can learn a little bit more about the organizations that they're coming from and the work that they've been doing in data science and AI. Bethany, do you mind if I start with you?
Sure. No, thank you for hosting this panel today. I'm really looking forward to hearing more from Mahadia and Angelou and just having this conversation. So Chris's introduction of these panelists represent deep experience in AI and data science with education peppered in. I think I come at it a bit from the other emphasis of, I consider myself sort of a lifelong educator, facilitator. And so I think a lot of what I'll talk about today, or the emphasis that I have, comes from that experience of both being faculty at Harvard and having students and fellows here that I nurture, but also having had faculty positions at the University of Rwanda, the University of Global Health Equity, and thinking about how we invest in our students in those contexts as well. And so I will really emphasize that. Now, where the intersection comes with this conversation is that some of our research, we have recognized the role of machine learning and artificial intelligence to really address specific health questions that we have. And so I don't posit myself as an AI specialist. I posit myself as someone who explores AI tools as they are appropriate for specific health needs. And so through that experience, I do come to this conversation thinking about the challenges and successes that we had in those projects and how we can think about investing in the workforce to address those.
I love the way you framed that, Bethany. More often than not, in the technology space, we're accused of being hammers, always looking for a nail. And the way you frame that as, you're exploring AI tools as they are appropriate is so incredibly important. I'm sure is going to be something that comes up again a little later in today's conversation. Angela, do you mind if I turn the mic over to you to share a little bit more about your experience and background?
Sure, Natasha. Thank you. Good morning, good afternoon, or good evening, wherever you are. I'm Angelou Marie Estrella from the Philippines. I hope you have Filipinos there watching us right now. Senior Manager at Reach 52. We are a social enterprise, Singapore headquartered. I think I've been working here for more than 3 years already. I'm a public health graduate, so I'm very much passionate as well with public health, healthcare services, and involving youth in nation building. I've been working with rural areas across the Philippines, bridging the gaps of the current healthcare systems, training health workers, empowering youth, women, screening, campaigns, health lectures, all sort of healthcare services that we wanted to deliver in those areas with low, poor, or no access at all to healthcare services. I'm very much excited with these sessions. I hope that I can share some of the things or experiences that I had with my work, or with my passion in the communities.
Thanks so much, Angelou. And I know we're definitely going to come back to that theme around how do we empower youth and women in particular. Mahadia, do you mind if I pass the mic over to you to talk about the work that you're doing with DLab?
Yeah, sure. Thank you. Hello, everyone. So with what we are working at DLab, so DLab, as it has been introduced, our main focus is to ensure that data is being used to make decision making at different levels, and being supported by U.S. Presidential Emergency Funds for HIV and AIDS relief. So most of our work has been in health sector. We have been developing tools and supporting development of tools. So just to give you a statistics, in Tanzania, 70% of medical professionals are situated in cities, where is only 25% of the population lives in cities, while in the remote areas where 70% of population is living, only 25% of medical professionals are found out there. So with that, AI becomes an important tool to ensure that these health professionals in remote areas get some sort of an assistance. For instance, we have supported a tool called Dr. Elsa, where it helps assisting community health workers when they visit their homes to be able to give appropriate advices. Yeah, and just another thing for Tanzania, 1 out of 3 children is stunted. So you can imagine. So for us, AI we use it as a tool, for instance, in that case, to advise mothers on the implication on the height and weight, and on the status, and what can that means, and what will be the patterns in future if we don't take action. So with that, that's where coming another thing where we only found that in all these activities that we are doing, AI is actually creating a divide in our community, because all these tools are being developed by men. So that's where we have partnered with Stanford University through Women in Data Science Conference to establish a program called Smart Girls, where we support girls. We train girls on coding skills and analytics, so that we can build appetite at that level. So it's just like trying to solve a problem at that level, so that in future we have enough women in the field. Yeah, thank you.
Thank you so much, Mahadia. You touched on a number of really interesting points that we'll pick up over the course of today's conversation, but there's one that I'd like to drill into first. You talked a little bit about the healthcare needs in rural Tanzania, the fact that In 70% of the population lives in rural areas, yet they only contain 20% of the medical professionals. So there's definitely a healthcare need and an opportunity to think more creatively around the role of AI technologies and how it can be applied in these settings. The question becomes then, how do we make sure that we are building the right kind of local capacity in data science and AI to ensure that those tools are built appropriately? So perhaps you can talk a little bit about why you decided to tackle this issue by training.
Yeah, so for us, by training is necessary because when you are deploying the tools, you want them to be sustained. So if you want these tools to be sustained, you have to build the local capacity so that they own the solution. So it's not like a solution that they are being provided. We want them to own the solution so that there is sustainability. So the locals own. It's not that tools are building cities and are being deployed in the rural areas. So we normally say that the rural areas become just as couriers, like they use the tools, they collect, data is being collected and being analyzed elsewhere. So we want these, we want rural areas as well to take the lead and to take the ownership so that these tools that we are deploying, they build also trust, with the AI models. If they don't understand how decisions are being made, also the issue of trust becomes also a challenge. And sometimes we even face another issue of over trust as well to some of the professionals. So building the skills is important to ensure that they build the trust, they make right decision, but they own the solution and it's being sustainable.
That's a great point. Bethany, I know you've been spending a lot of time thinking about how to really build local capacity within the markets you're working in, particularly Rwanda. I'm curious, did you find a similar impetus to building that local capacity?
Yeah, I mean, I definitely think the point around sustainability is super important. And want to just put an exclamation point on that point, Mahadia. I think the other point I would make with that is when left to my own devices, the questions I might pursue, the agenda I might prioritize may not align with what would be the most important or impactful. And so I think having colleagues that we engage with as peers and as leader, they are the leaders and we are really following their lead, for me has been important. Certainly the work that we have where we have collaborators that are highly skilled, sometimes the most highly skilled on our team, those are the projects that we see the shortest time from a research proposal to an actual program change or policy impact. And so in addition to sustaining work, I think just identifying priorities and really shortening the timeline from question to impact requires that the leadership sit where the projects sit or where the questions sit or the needs sit. And so for me, that's been a real motivator for investing in that leadership.
And what skills have you found are critical to building that local leadership and capacity?
That's a great question. I mean, all. I think what's really, so let me back up. My first bias is I'm a statistician by training. So, my knee-jerk reaction is to say everybody should learn mathematics and statistics. But then I realized, and when I think about our projects, we had some engineering challenges, and I am not an engineer. And finding folks who we could engage in engineers, both in the US or in Rwanda, was a real challenge. And so, I really think it has to be addressed comprehensively in terms of skill sets. I will say, again, Mahadia, to your comment about some of the DLAB initiatives, I am a real believer in just strong foundational training. I think this work requires a lot of specialists, but you're not going to get those specialists if you're not investing in foundations. And so if we don't have degree programs in computer science, mathematics, and statistics at a bachelor's level, creating PhD programs in statistics is not going to fill the void that exists. And I would go back, my first job was as a high school math teacher in Northern Namibia. And I would go back to the foundations of high school education. And, Mahadia, to your point around the Smart Girls Clubs, I think really investing in strong foundations such that as people progress in their careers and they say, not only do I love math, but I want to specialize in this expertise, they have the foundation they can draw on to get that specialty training.
An interesting
So all of the above is basically my answer.
I particularly like the point that you made around investing in strong foundations and even going back to the basics around high school education. In many cases, we've seen an emphasis on improving primary school education, in some cases even secondary school education. Yet when you were noting this idea of investing in some of the higher skills, you talked about how there's still some gaps around the foundations. So why aren't we seeing appropriate investment in some of the foundations today? What's the challenges that we still need to overcome? And that question's open to any three of you.
Sorry, so maybe I just wanted to contribute there. So regarding the foundation, so I will talk about in my context where we talk about even to the level of a degree level, we don't have data related courses. So you only find them at the master's level. So I think it also we have to get buy-in of the leaders, and also we have to get the political buy-in. So as we are training these technical people, we should also find a way on how we can be able to bring on board the leaders, the decision makers, so that they see the value, so that we can influence to like changing our curriculum. So I'm talking for our own context. If even at the degree level you don't have data related courses, you expect them to come and specialize at master's level, where I tell you our master's is this year is the third year batch. We are facing a bigger challenge because of the foundation, because you get good computer science student, but with less mathematical, they have less mathematics, and then you have good statistics students with less programming. So like these things are not thought at that early stages. They just come to learn at the master's level. Imagine training a person at the master's level, basics of programming. At the same time, they have to catch up. They have like big data analytics courses, etc. So you find that is quite a challenge. So for me, I feel that we need to engage the leader, the decision maker, so that this is also taken on board by them. So it becomes a policy issue. It becomes institutionalized. So yeah, so that will be my contribution toward that.
I think engaging leadership to get their buy-in and investment is so incredibly important. But I think back to some of the most successful models in market dynamics, and there's a combination of a push and pull. Do you feel like there's enough demand and appetite amongst the students to push leadership on this point? Is there enough awareness around the kinds of opportunities that exist in data science, in AI? Mahadia, maybe you can pick up on that point.
Yeah, definitely there is opportunity and there is a demand. So for like before we started a master's in data science program, so DLab started as a project. So during the project, we used to deliver short programs. So I'm coming to the point of Bethany. So these short-term programs, we then realized they will not be able to produce that data scientist that will be able to build models to work in the field and provide a concrete solution. So that's where we engage the university. And the only way that we could be able to engage them is through the master's level, because that's the level that they can quickly design the program. But we did a training need assessment, and whereby 90%, so we had a list on the data related skills that are being required within the organization. And you'll find that most of the organization listed AI, data analytics, machine learning, big data, because all these skills are actually, like, for our country, you have to get them from outside. When you talk about a data scientist in a telecom company, will be somebody from outside. They'll have to hire them from outside. So definitely there is a demand. There's a lot of data. There's a lot of data that is being produced, but certainly it's not being analyzed, and that's what we are pushing towards, showing the facts so that we get the political buy-in. Just to give you a hint, now I'm in the Dodoma, the capital city of our country, where we are now working with the local government authority training program to embed data related skills for decision makers. We are talking about the counselors, the ward executive officers, etc. So we want these people to understand so that they can influence the decision making. But certainly there is a demand.
That's great to hear that that demand exists. And Dodoma always has a special place in my heart because my father was actually born there. Angela, I'd love to bring you into the conversation. We've had a lot of really interesting discussion around ensuring that demand exists for these kind of skill sets. The fact that there's a lot of this data that's being produced but not analyzed. What's been your experience in Southeast Asia in the markets that you've worked in? Have you seen through your work that there is that demand, there is that appetite? What's happening with a lot of the data that you're creating through the work that you're doing?
Yeah, thank you so much for the question. And to add on Halia's thoughts on this one, I think here, especially in Southeast Asia or low middle income countries, I think we work in like an intra-organizational structure in which like the higher officials or the emerging leaders are there on top, which gets a lot of the investment of this educational system. But then, you know, I think there should be a shift on the focus that should be on the grassroots, on the bottom part, because this is where the demand is. I mean, this is where people need help or educational or improvement with their professional learning. So yeah, here in Southeast Asia, the demand is really high. So in my line of work, what we do is we capture this data through digital solutions that we have. So we have offline apps that we deliver in the communities. We train health workers on the ground, since we are seeing like the lack of trainings, educational system on the ground, and these are the people who are actually experiencing the problem. Because they are the one experiencing the problem, they should be part of that solution. So we should shift that investment. You know, we should invest more to these people who need it the most. So our trainings focus more on the health workers, young leaders who are very much passionate to change the system or to make a difference in their own communities. So digital solutions, that is what we are giving to the community, which is very much helpful, especially in this challenging times that we have.
Indeed. I'm curious, based on all three of your experiences, what are the models of training and education that you found to be the most successful, either drawing from your own personal experience or some of the models you've seen in your own backyard? What were the elements of them that made them successful? So you talked a little bit about the engagement of youth, the kind of starting at the grassroots level. Angela, do you mind if I turn the mic over to you to kind of build on that idea?
Yeah, so maybe I should give like more or share more about what we do in the community. So in this generation in which I think we are embracing technology, there are this is what we usually do in our communities. We train them how to use technology. We profile people in the community because we want to know their status. We are a digital healthcare company, so what we do is we profile these people because we wanted to know their health status. So we usually bank on the health diseases, health conditions that they have, so we would know the interventions or the prevention that we should be doing. So most of the time, these are non-communicable diseases. So once we know the status of these community members, we would know what to do in order to prevent that, or what intervention, health lectures, screening, diagnostics, campaign, what are their needs. This is very, the digital solutions that we have is very vital in capturing data to analyze what the community needs, and for us to actually know the solution that we should be giving or we should be investing to them.
And once you profile these individuals and better understand kind of their needs, how do you then engage those community members in then supporting your solution design and refinements and the digital tools themselves?
I think this is where the integration of public and private sector comes in. I think we should acknowledge the fact that we should work hand in hand, collaborate, and connect with people that can actually help us. We are here helping institutions to deliver their projects. So once we've gathered the data of what the community needs, we give that to people who can also, or to institutions, government facilities. So this is a government and non-government relationship that we are building. So we communicate with municipal health officers or rural health units and the community, because we are working with communities in which we have one doctor in like 80,000 population. So what can a doctor do with that 80,000? It's just one. She cannot divide herself. So that's why she needs what we can offer to the community, so that she would know how to help them further, or how to enhance this services or deliver more healthcare services that her community needs. So yeah, I think from us, we integrate it to the current system so that it improves moving forward.
That's great. Mahadia, based on the work that you're doing with D-Lab, I'm curious, from an education and training perspective, what are the models that you've seen work, that you've integrated into the work that you've then pushed forward through D-Lab?
Okay, so our model is, so D-Lab, the way it is organized, we have several pillars, but the central pillar, we call it community engagement. So we run the so-called listening campaigns. So whenever we have a new project, or whenever we want to design a curriculum, etc., we run the so-called listening campaign, where we go to the community and identify the pertinent challenge. So this pertinent challenge helps us in two ways. In two. First, when we identify a pertinent challenge with the community, if we want to build the solution, the community becomes part of that solution because they have identified that as part of their challenge. But then these challenges as well, we use them as use cases in our curriculum, so that when we are training, we are engaging them through targeting their pain point in the community. And we use similar cases even for private sector, identifying like what thing matters most for them, and then building use cases around the curriculum that we are going to develop for them. So for us, our motto is around, we call the so-called listening campaign. Identify what's the pertinent challenge, turn that challenge into something that you can use to engage them.
That's great. I want to come back to this idea of community engagement, because I think it's been mentioned by everyone. And I think it speaks to the fact that when we are trying to design solutions, when we're trying to scale solutions, when we're trying to sustain solutions, we need to have the right stakeholders engaged throughout the process. And I think it speaks to this idea that there needs to be a level of equity in mind in the way in which we're thinking about AI-driven solutions. So Bethany, I'd love to better understand from you, as we're creating these data science programs and these AI and machine learning driven solutions, how do we ensure that those models that we're developing are designed with equity? And how do we think about that then when we're creating and supporting education and training programs?
Yeah, I mean, it's all very related in my mind. So first, I want to also just echo the sentiment. There is huge demand for the training programs that I'm peripheral to. Just inspiring, overwhelming, sometimes frustrating that we can't meet those demands. But I just want to enforce that sentiment that I think if there are folks engaged in this call or in this community that want to invest in these programs, the demand is not the issue from my side. The other point, which is really related to your question, is how do we ensure that the questions that we're asking, the models that we're developing, are not excluding populations, and specifically the populations that are the most in need. And for me, it really gets to, representation matters, right? And so as we just generally talk about engaging the African leadership and workforce and empowering that workforce to lead AI and data science work, I think that is a necessary component to elevating African-based questions and African-based solutions in that work, or Southeast Asian solutions. So I think that's important. Now, even within those communities, it's not a homogenous community, and I definitely think globally we struggle to get women into the fields of art and supported in the fields of artificial intelligence and data science. I think specifically in the countries where I work, we've had challenges of getting folks from rural communities into these fields, and I think it's incredibly important. I think having people from diverse fields of study is super important. So we need folks who come in with expertise in maternal and child health just as much as we need people coming in with infectious diseases, just as much as we need the technical data science and AI skills. And so I think all of that, having that representation, and particularly giving an eye to communities that have been traditionally excluded in these training opportunities, or even if they're trained, are not fairly engaged in the work, is incredibly important. I do want to loop back to your question around training models, because when I first thought about that question, I immediately thought about some of these innovative, out of the academic setting models in terms of, I follow D-Lab's work quite closely, and I see the training that they do, and a lot of folks I talk to in Rwanda have had touches from D-Lab. The ones that really create and nurture community, like the Deep Learning Indaba, Black and AI, I think are really incredible, inspiring. They don't just build a network of folks working in these fields, but they also invest and make sure that those with more experience are helping grow folks who are newer to the work. But I also, as I think about that response, want to make sure that we're not innovating just for the sake of innovation, or let's be innovative, but let's also invest in the tried and true methods of, degree programs do matter. We need to create and invest in strong master's and PhD programs in the various disciplines that are needed to grow this field in whatever context, right? So I just want to make sure that as we think about training models, that we also endorse investing in university degree programs as well. So
I love
a
that
very
take around, like, let's invest in those things that are tried and true. And it brings me to a question that I see has come up in the amongst the audience members around the practical steps we can take to drive greater education and training, many of which have already been talked about. You talked about that investment in degree programs, master's, PhD programs, strengthening some of that earlier educational platforms that really focus on the fundamentals. You mentioned this idea of building a network, some of the great work that D-Lab does. Are there any other practical steps that you can see that would help us as we're thinking about education and training in order to ensure that that diversity that you talked about is reflected in the population that then gets trained? Maybe Bethany, I can start with you.
I mean, it's hard to know how to respond because these are challenges that I see even within my own institution that has resources and in theory has had degree programs for longer. So it's hard. You know, you could see it from the carrot or from the stick approach. I think we need to support and reward programs that really invest, bring diversity to this workforce. However that's defined, but you know, I think we need to reward and invest in those programs. I think we also need to stop funding programs that are just producing a very homogenous type of people coming to the work, right? So, you know, if there are certain degree programs that have a reputation for not being recruiting or supporting the women that they recruit, we need as a community to just work with them to improve those programs and make sure that that's remedied or not perpetuated. And so I think there's a lot of groups that are doing great work in that area. And so I always prefer the carrot approach. Really investing in those that have demonstrated commitment to bringing diversity to this field is incredibly important. And so I don't necessarily think there's a magic bullet as much as it's let's invest in folks that are demonstrating that commitment.
Hadia, I'm curious how you might build on that point around the carrot and stick, and how do we really ensure that we're investing in those right programs? What are those practical steps that we can take?
So I would talk about our experience from the project to NGO and how we have been transforming. So when we started a D-Lab project in 2016, we were ambitious. We wanted to produce data scientists. But when we conducted our first training need assessment, we realized that people needed just to understand Excel. So when you're talking about steps, we need to understand first what community we are working with. Whatever the method that might be work at our place might not be working elsewhere. So for us, we had first to start. So for the first year, we had to start with basic data skills. First, the data literacy skills, and then the Excel skills, and then exploratory data analysis. So those were the basic skills that they were needed at the time. And then later during the course is when that we realized that we needed to build more advanced programs. So for us, we have categorized our program in two areas because of our contest. So our contest, if you don't have any science background, you cannot go into data science programs. So for that matter, so we have so one approach, we engage the university, and with the university, we design the Masters in Data Science program. But with the other population that we feel that they can be also good data scientists, so we designed a data fellow program where it's a learning by doing. We train them on data science skills, and then we we find organization where they have data related challenge, and we attach to those organizations so that they practice their skills, and in case they need support, we can provide that support. In the other thing that we are doing, even with the university Masters in Data Science program, we also identify the organization that have data related challenges. So their capstone project, where we supervise as Tanzania Data Lab, we ensure that each student is attached to a certain organization where they are working with the real world problem, so that they are able to actually learn applying the skills. You know, there's learning the model, and there's another thing about applying them. So that's what we are doing, like let them attach them to this organization and solve real world challenge. And in case we need support, so for us as well, we don't have expertise in all areas, so we work with other university as well, where we felt that we need a certain expertise, and we connect students as well. So that has been our model. And then the other one that I mentioned, that are trying to catch them early, going to the secondary schools, introducing the coding skills and data analytics skills. So it has been that way, but I think this problem has to be thought in terms of 360 degrees. Like there's no a particular approach, but we need to think, we need to act with the younger generation. We need to have intervention at the current generation we need to work in terms of policy, but also, yeah, we need to build right curriculums. So we need to have that 360 degree angle.
I love the 360 degree analogy here. And another thing I loved was that connection you made between learning and application. And I think we've talked a lot about this idea of training and education. One thing we haven't really talked about quite yet is this idea of retention. How do we actually ensure that once we train these folks from these diverse backgrounds, that those skills and those individuals and that diversity actually stays in the sectors that need it most? And how do we avoid potential brain drain? Mahadia, does that ever come up in the ways in which you're thinking about training, or in the organizations that you connect them to for the application of that skill set?
The reason I'm smiling, the first batch in our data science, as I say, that we are being supported with PEPFAR, the U.S. Presidential Fund for HIV/AIDS relief. So these students, we wanted their primary focus to be on health and HIV/AIDS, which they did in capstone and their thesis, but all of them now, just prior to graduation, they're employed in telecom. So that was that is quite a challenge in terms of how do we retain them. But I will talk about the experience with the organization here is called BMF, Benjamin Mkapa Foundation, where what they do is actually they deploy these skills that are needed most in the health sector, and then they deploy them, and then they pay them the salary nearly equal to where if they could work, let's say, in telecom. And then they deploy, let's say, in government facilities in remote areas, but with the equal salary with the person working in somewhere very competitive. And then, so this program, like I think the last program was, I think it's 5 years or so. So with this program, at least it has it helped in such a way that even when the program ended, some of the doctors still remain because they get connected and attached. But with these younger ones, where we give them scholarship, it's very hard, because they're at that stage where they are looking at where do I get that higher salary. So we need to find a way on how we can get them connected to the actual problem or actual before. So yeah, so I think we should think of that way, but it's really quite a challenge because they're not living in a vacuum. So that's the challenge where it comes in.
Yeah, I think you speak to the challenges quite brilliantly, and I appreciate you sharing the challenges that you had with that first cohort of graduates from D-Lab. I really like that model you highlighted where their salary is supplemented. My big question was, oh, how sustainable is that going to be? But it sounded like through that model, there was a level of stickiness that they got through that investment that allowed them to stay within that sector that so desperately needed that skill set. Bethany, I'm curious, have you had a similar experience as you're thinking about how do you really retain those skills in the sectors that need it most?
Yeah, well, I mean, one is the sectors that need it most. Probably the person at telecom thinks that the telecom sector needs it most, right? And telecommunications is a huge part of economy and infrastructure and health. And so, what the question makes me think of is, so I've been supporting research and research training in Rwanda for about 10 years now. And we had developed with our colleagues at Partners in Health and the University of Rwanda, we had developed a training program that was meant to be sort of self-perpetuating after like 6 or 7 years. And one of the challenges was a lot of our colleagues who were like an investment of that training program left the program or left that sort of that wheel. And I remember voicing frustration around that of like, we had this vision and they've, disrupted that vision because they left. And Agnes Benoit, who had always been really supportive of that program, was in the Ministry of Health. She looked at me and she said, well, it's your problem because you're just not training enough people. You just need to train more people. So like to some degree, it's just a saturation issue, right? We need to be training enough people such that those who are drawn to telecom can find their footing in telecom, and those who are drawn to public health can find their footing in public health, and those that are drawn to developing computers and robots and whatnot, like there's a place for everybody if we can invest enough in it. So that's one thought. The other is, we struggle a lot because NGO salaries, ministry salaries, they are oftentimes not competitive with the private sector. And top-ups might be an option in some places, might not be options in others, but not everybody is drawn to the salary. I can almost guarantee that most folks on this call, panelists included, could probably make more money doing something else, right? And so there's other reasons why you stay in the work. And I think really one, identifying people coming into your training program who might have those motivations, and then helping them stay in the sector, even if you can't offer them a telecom salary. And for us, that's really been in like continued professional development opportunities, and then also in autonomy, right? So if someone feels like if they stay working peripheral to me, that they're always under my thumb and have to do what I ask them to do, like that doesn't give them a lot of professional growth opportunity. And so we really do try to let folks stay within the organization, but forge their own way and have professional growth, have other training opportunities as a way to recruit them if we can't match the salaries that private sector might offer them. So the simple solution is just train more people, and eventually you'll hit saturation. I think in the short term, before we hit that saturation, finding other ways that we compel people to stay in the sector or really help them realize their goal of wanting to stay in the sector are options for us.
So we've been receiving a lot of great questions from the audience, some of which we've answered already through the course of this discussion. There's one question here that I don't think we've touched upon, and that is around emotional intelligence. We've talked a lot about the professional and more technical skills that are required from an education and a training perspective, but we know that healthcare and the development of appropriate AI tools and machine learning tools requires a level of emotional intelligence. How are you thinking about some of the softer skills in the training and education programs that you are developing?
Okay. Yeah, I might try to to answer that one. And also I think this can also answer maybe the previous question that you have, with the models, the training models that we have, or this emotional intelligence that is actually should be there. It should be an understanding that we know, we acknowledge, that we are aware of. I would maybe say an example here in, like, in my country or in low middle income countries, that resources are not evenly distributed. And I think there's a question always with how can we distribute this resources. I live in the city, but I work with rural areas. And but I know here in the city we are always trained. We have a lot of universities, schools that we receive these trainings. But when you go to rural areas or to those mountains, in which, like, an hour away from the nearest access to whichever, or like pharmacies or stores or whatsoever, they are not that educated. They don't have any learnings about this and that. They are not aware of that. So I think we need to make them aware about it. We need to make them understand of the situation, because we cannot give solution to a problem in which the community themselves are not aware of it. So I think we need to we need to expound further with that, and empower them and give them the services, resources that they need, may it be physically, emotionally, that could help them, grow and be aware of what is happening, and empower them and let them be part of the solution. Because in terms of sustainability, it's not all the time that you can go there. So that's why I think our solution with digital apps, which also work offline, it works in gathering this data for us to understand what they need, if whatever is that. So you cannot you cannot inject a solution to a community, or which doesn't need that. So I think, yeah, a better understanding of the community you're serving is very much important.
Now, I appreciate you bringing us back to this point around empowerment alongside awareness, because I think the two need to come together in order to drive the demand that we talked about earlier in the conversation. I know we are quickly coming up on time, so perhaps one last question to each of our panelists, and hopefully you can keep it really brief. And it's around this point of collaboration. So it speaks back to that 360 model, Mahadia, that you referenced earlier in the conversation. We know that we need multiple different stakeholders to work together in order to drive the kind of education, training, and investment needed to ensure the scale and sustainability of a skilled workforce. What's the one thing, the top thing that we can do to drive that collaboration? And maybe Mahadia, I'm going to start with you.
So for me, collaborations, especially in this area, start with the trust and being honest on what you want to achieve, so that that collaboration can be sustainable. So for me, trust is one important thing. I know time is over, I cannot expand on that, but trust and honest on what we want to achieve, so that we can build sustainable networks and collaborations.
I love that. Angelou, what would you add to that?
I have a lot in mind. I cannot construct really, but I think in terms of collaboration, maybe stakeholders need to set aside personal interest and accept new changes that will make a difference in your community. And you have to think all the time that beyond these interests, personal interests, there's a community which has real problem. So I think we need to focus more on those people, so that integration, collaboration of these new digital solutions can be possible and successful.
I love that. Setting aside personal interests, and coming together around the greater good. Bethany, last words from you. Make them count.
So in terms of collaboration, it really touches on a lot of these last points of, not everybody is going to have all the things that you need to do a successful project. And so your data scientist may not have the content expertise. Your person with content expertise may not have the community linkages. And so really, or the emotional intelligence, and where does that come in, and who's the facilitator? So for me, I would say the one thing is proximity matters, and creating spaces, virtual, but I'm a true believer in in-person proximity, creating spaces where we can link these different individuals. And that has to be a funded endeavor. People are not just going to, your community members are not just going to find their way to a data scientist without intentionality, and that intentionality does not come without funding. And so I think we need to invest in creating these communities that have very different skills and ideas and perspectives represented in those communities to move this work forward in a collaborative way.
Fantastic point. And a huge thank you to all three of you for your reflections and insights today on AI health in the future workforce. With that, I would like to pass the mic back to Carissa for some closing remarks.
Great. Thank you so much, Natasha. That concludes the third webinar in our new virtual event series. Thank you to our panelists and our moderator for such a wonderful and deeply engaging conversation. We're grateful for your time, as we know how truly valuable it is. Thank you to our partners, the Novartis Foundation and the United Nations Institute for Training and Research, for your collaboration on this event. To our audience, thank you for joining us. We hope to see you again on Thursday, December 17th for our virtual networking event. And have a wonderful afternoon or evening wherever you are.